By one recent measure, Greater Boston is the country's best metropolitan area. There's growth, economic strength, and cultural diversity. But other numbers show reasons for concern, especially the indicators of economic and racial inequality. These were the subject of the new Regional Indicators report from the Metropolitan Area Planning Council. We'd like to welcome one of the co-authors, who's also a research analyst and data engagement specialist, Jessie Partridge, and a public health planner, Kate Ito. Thank you both very much for being with us. I want to start with Jessie. This is a follow-up on a report done in 2011, so how things look by comparison, and is this inequality overall, is it getting worse, is it getting better, what's happening?
Yeah, so there's not one straight answer, but I would say what we've seen generally is things have not stayed the same and across the board we're still seeing large disparities by race and ethnicity and some other measures. We have seen some movement in the right direction for children. Testing scores, graduation rates have improved across the board, and some racial and ethnic gaps have closed. For adults, however, we haven't seen the same sort of economic outcomes improvement in those indicators. There's still kind of widening income disparity.
Let's talk about the top 20% versus the bottom 20%. Mm-hmm. I found that to be pretty depressing.
Yeah, yeah. I mean, it's depressing in a number of ways. Number one, just the huge disparity in income for the 20% of the households that are the wealthiest. Their average income is somewhere around $270,000 or more than that. And then for the lowest 20% of lowest income 20% of households, the average income is only just under $15,000, which is not a living wage by any standard. But what we've seen is that disparity has actually grown since 2006, so that people at the top have increased their income in inflation-adjusted dollars by 13%, but that bottom 20% has actually declined by 1%.
Kate Ito, talk about some of these health indicators. To begin, the ones where things are actually getting better for some reason. What do we learn from that?
Yeah, well, we learned that health is a major part of equity, and that's what I think is really interesting about this report, is that it kind of covers the life stages and incorporates many different sectors and many different indicators across health. We've seen particular improvements in young children. So two of the indicators that we really look at the childhood level is low birth weight. So how many singleton babies are being born that are less than 5.5 pounds. And then the other one that we have introduced this time around in our update to the State of Equity report, which was a suggestion from one of our advisory group members, was actually to look at childhood blood lead poisoning. And we've seen significant improvements across. We looked at that indicator both by municipality, so we found that more. Unfortunately, it's still more urban municipalities have higher rates of blood lead poisoning than their suburban counterparts, but the rates have basically dropped in the last 5 years.
And yet you still have these really staggering racial disparities in things like hospitalizations for asthma, diabetes, hypertension. I mean, you get quite a list.
We do. We have a pretty complex list. We looked at least 5 hospitalization data points of major chronic diseases across the lifespan. And why those are interesting is that they're all very good indicators of general health, because there are many causes for why someone may have diabetes, hypertension, asthma. So what they are really indicating is overall health. And so we saw stark differences among races for the chronic diseases in adults. So what we're seeing is that these disparities are still there, but what's great about this report is that we can now track our progress and really look at these types of indicators.
This is BNN News. We're talking with Kate Ito and Jessie Partridge from the Metropolitan Area Planning Council. Jessie, there's another thing that you picked up on in this report since 2011, and that's the loss of these middle-income jobs. This almost sounds like a plug for Donald Trump here. Why is that so worrisome?
Yeah, we've seen a decline. So we've seen a loss in working households that are in the middle income range. And what we really dug into in the research that we did showed that this is both due to kind of high housing prices in the region, which we all know it's an expensive place to live, but also just the decline in some of the kind of typical middle income wage industries, such as manufacturing or installation and repair work. So that was a pretty big finding.
Of course, what I also infer from this is that between that distressed middle and the people below it, you get the sense that even just since 2011, you don't have as much of that kind of hope and upward mobility that we used to have. Isn't that one thing that's probably inevitable to take away from this?
Yeah, absolutely, absolutely. It's harder to kind of move up in the income span when you're kind of so low at the bottom.
Kate, this report also picked up on the persistence of these old patterns of racial segregation, and thinking of this on the metropolitan scale too. How does that affect one's health, you think?
Well, so health starts long before we reach the hospital. It starts in our homes, it starts where we go to school, it starts in our neighborhoods. And so we are seeing the persistence of that type of historical problems today. So health, that's why I believe health is such an important part of this report, and that's what makes it really unique, that health is so intertwined with equity.
Jessie, talk about the racial patterns in terms of where people live. I know this is not just the city of Boston, this is the whole metropolitan area, but what's the trend that you see now?
Yeah, well, a bit of new research that we did for this update really showed that, we know we have racial segregation in the region, but we also see this economic segregation and kind of and racial segregation together, so that a household that makes $10,000 or let's say $80,000, a white household that makes $80,000 is going to be living in a neighborhood where kind of the average household income is closer to $70,000, but a Black or Latino household that makes $80,000 will live in a neighborhood where the average incomes are much lower.
Because one other interesting thing about segregation your report got into was that it's easier to build affordable housing that's not racially diverse, and probably, let's say, in the city where there's less resistance to that. But what do you lose when you go that path of least resistance as opposed to having housing that might be more diverse, maybe in a suburb? What happens?
Well, I think the really important thing is that folks have a choice about where they live. I mean, some folks want to live in the city, some folks want to live in the suburbs, and we should be able to choose where we live, regardless of our race, regardless of our income. So the opportunity to live in an affordable housing unit in the suburbs might be really appealing to some folks, but is not available right now. So that's, I think, why we work on policy to expand opportunity throughout the region for lower income households.
And Kate, what about access to health care or even at least insurance? I mean, you would think that we're pretty good about that, but how good are we?
Yeah, well, so we are one of the best states in the country for in terms of health insurance. So many of our indicators, again, are hospitalizations, and so we do see that potentially the numbers are going up mainly because people have more access to care, and that is a good thing, and it's important for us to continue to track that.
Finally, Jessie, just briefly, if you can tell us what the next step is here, because we have all these numbers, and I guess the next thing is, where does the policy come in?
Yeah, that's exactly it. What do we do now? So after our 2011 report, we published a State of Equity policy agenda. And so what we're working on now and really looking for input from the folks in the region is what should we do to update our policy agenda to kind of move the needle again towards more economic and economic outcomes that are better better health.
And finally, you've got a place online where people can get more information as well?
Yes, so regionalindicators.org is where you can find the full report. MAPC.org is where you can find more information about.
Right. Thank you both very much.
Thank you.
Jessie Partridge and Kate Ito from the Metropolitan Area Planning Council. In a moment, Boys to Men. We'll hear about the next concert by the Boston Gay Men's Chorus.